Thank you, JPIS, for inviting me over. I am one of those less confused humans, and I actually get a calling much before it happens in my life. When I was in school, I knew I was supposed to become a doctor. When I got into medicine, I wanted to be a surgeon. When I was into surgery, I knew I had to be a GI surgeon. When I was a GI surgeon, I knew I had to leave Delhi and come back to, or go to a place which was Tier 2 and establish a department, try my own methods, try my own caliber, and try to prove to the world what I could do, which I was not very sure about. So, Kaizen, as we all understand, it means continuous improvement that eventually translates into growth. And I'll try to give you a brief of my journey, which is, you can say, a prototype of a typical surgeon, and how Kaizen helps the surgical career, not only for the surgeon, but it brings about changes in the surgical outcomes and therefore transforms the lives of the patients. So soon after I came to Rajasthan, I was fortunately the first one to come to Rajasthan. This specialty was not new. I was the only person in the entire state who knew about this subject, and I had to start on my own, which means that I had to start operating on whatever complex advanced diseases I had to face and delve into kind of 12, 14 hours long operations just with 2 nurses. And I did not have anybody to fall back upon if I was into problems. Starting from that day, I ventured into minimal access surgery. When in India or even abroad, there were no structured training programs available. What I could do in those days, even the YouTubes and the videos were not very commonly available, and I could only rely upon the publications in various prestigious journals internationally and think about how something like that could happen. I would imagine my own ways, use my own traditional equipments to transform them and translate them into utilizable equipment, and then perform the surgery through laparoscopic methods. Then, soon after, I realized over the next 6 or 7 years when I quietly was doing that, unknowingly that I was doing something which was not actually very, very kind of established in the country, in this part of the world, I realized that I had already probably mastered some techniques of laparoscopic surgery, which not many people in India had done by that time. Naturally, I became a proctor. I used to get invitations from all over the country and abroad to deliberate, talk about those techniques, complex surgeries, live demonstrations, etc., etc. Traveled extensively, and then we started the first teaching department out here, and I take pride in mentioning that today we have that teaching department which serves training for the meritorious students who come from all across the country through the national selection and counseling and kind of obtain the training in surgical gastroenterology and minimal access surgery. Thereafter, we had publications, and now realizing at this stage that there are some managerial hassles which also actually impact the outcome of patients, I tried to get into a startup which deals in digitization of clinical content along with 2 techies. That's the background actually, and with this background, I will be able to tell you what surgeons face. I'm sure all of you would probably perceive surgeons, if you look at their positive attributes, confident, assertive, skilled, knowledgeable, dedicated, hardworking, calm under pressure, and they give attention to details, but there are so many negative aspects to it also. Many of us would have perceived them as arrogant, overbearing, emotionally detached, workaholic, stressful, and intense. We tend to sometimes realize that they have diverse personalities. Everybody does not belong to the same category. They are also humans, and they also have empathy and compassion. But they sometimes tend to get implicated in the situational, circumstantial, and infrastructural reasons, which tend to sometimes pose a lot of burden and stress on their head. I myself, I don't know whether I have all of these positive attributes or not, but I'm sure I had all of these negative attributes at some point of time in my career. because it's a challenge for a surgeon to perform. It requires perfect performance with precision and under pressure all the time. Another profession which you can probably try and relate to, or try and compare surgeons with, would be a pilot, because both of these professions tend to deal with lives. The decision making is very critical. The decision making is very, very spontaneous. It's based on the technology, but it's also based on your experience and expertise, which you have gathered during your training and later on. But there's a difference. There's a difference. For pilots, usually it's a very straightforward method because it's a highly structured environment and clear protocols and the team. For surgeons, it requires a lot of adaptability and individual judgment all the time, 100 times in a day, because every patient is different, every disease is different, every treatment is different, and every outcome becomes different when you try to combine all of these factors together. No wonder many of the surgeons face a burnout. And this is just a typical example. This was a publication, and this is from developed countries. And they will tell you that burnout is very common and frequently not recognized and not understood. It is a personal crisis, and it creates vulnerability at work. Look at this Medscape data. 42% of all physicians get burned out. This is from US. And look at this. The Generation X, which I belong to, has faced the maximum incidence of burnout. The generation before us faced less burnout, perhaps because the circumstances were better. There was not that much of pressure. And the generation next, the generation millennial or the generation Y, the incidence is further less because now perhaps the technology and the aids and assistance and managerial capability has probably eased out the system a bit for the surgeons. Overall, when you try to judge a surgeon, it's an individual performance, it's a team's performance, and it's the infrastructural support. But the maximum accountability of every single case depends on the surgeon or is translated to surgeon's capability. Just try to look at this. This is my own theory. I've not taken it from anywhere. Every surgeon goes through these stages in life. As a trainee surgeon, as an independent surgeon initially, he is underconfident. He starts working, he does a bit of surgery, he accumulates experience, he becomes confident. Thereon, he goes on to become overconfident and sometimes even arrogant. And then he realizes his mistakes. With the help of feedback, with the help of colleagues, with the help of trying to self-reflect himself, and mindfulness, and then his confidence comes down a little. He becomes more careful with his undertakings. And that's what I call a surgeon with optimized confidence, which can now probably give you the best outcome. So what happens? Why I'm trying to give you this background? Because here comes the role of Kaizen. Why do we become overconfident? Because we have extensive training, high stakes responsibility, we have professional recognition, we have awards, accolades, and we become very busy very soon. It's a very strange phenomena. All of these things work on faith. So if you have a busy surgeon, all the people would want to go to him because they believe that he is the best, despite the fact he might be more busy. So we tend to sometimes increase our risk-taking capability. We pay less attention to details. Our team dynamics go haywire, and sometimes it can affect the patient outcomes also. And therefore, how do we mitigate this? Here comes the role of Kaizen. Once you know you are a surgeon, once you have achieved that level of competence I would say, and of course the confidence, then you have to improve the results beyond that level or the standard level that you can say. That's where comes the continuous learning and humility, feedback and peer review, team-based approach, self-reflection, and mindfulness. And this is the role of Kaizen. all of you, maybe at some point of time in your career, at this point of time as students, you might actually be confused as to what you desire when you grow through your career in your initial years. I very, very strongly feel, and I've experienced it myself, and I used to utter it to my seniors, my juniors, my colleagues almost all the time. For almost about between the ages of, say, I would say between 30 and 50, I was always very happy, and I used to quote it, that I'm not bothered about money. You give me more work, I'm more happy. So a surgeon with more work, less money, would be happier than surgeon with less work and more money. And I do very strongly feel that this stands true for all the people who are professionals, be it architects, be it surgeons, be it artists, be it everyone. In the first few years, it is the amount of work and what you have excelled and got yourself trained at. If you are able to deliver that, you'll be happier rather than if you achieve something but make more money but achieve less, kind of. And therefore, it is this Herzberg's theory which kind of helps you define your team's performance. If you look at the motivators in the early phase of your career, it is the work itself, the achievement, the recognition, the responsibility, and the advancement that makes you happy. Sometimes there are dissatisfiers, which means administrative policies, salary, interpersonal relations, and working conditions. Therefore, in the initial stages of your career, I think it will give you more satisfaction and happiness if you try to look at the satisfying factors or the motivational factors. Kaizen principles say that everyone in your team should be involved in your daily improvement. And surgeons and the frontline staff work together. That's only when the outcomes improve. Solutions have to be small and incremental. You cannot think about doing disruptive changes and bring them through into your practice maybe over 6 months. That perhaps does not improve the outcome. It is the small, sustained improvement every single day by every single member of your team that brings about the improvement and transforms into huge, huge outcome benefit. And it is also dependent on the speed at which these improvements are undertaken. Therefore, Kaizen is not a process, Kaizen is not a managerial process. It should so happen that Kaizen becomes a culture of every unit. Feedback becomes a culture of every unit, and then only you can transform. Therefore, if you look at the challenges and solutions for surgeons in the Indian healthcare system particularly, you will find that there are infrastructural limitations, there are resource constraints. These are the things which can be optimized with the help of Kaizen, small, simple improvement every single day. Managing patient expectations, communication and transparency can also be, I'm sure, transformed through Kaizen principles. Ethical responsibilities, of course, come, and it becomes our moral responsibility and a professional responsibility to continue educating, to continue innovating, and to continue mentoring our juniors and colleagues, which helps bringing about the change. And how Kaizen helps, once you have brought about 50, 100, 200, 300,000 improvements in your practices over years, you tend to become very resilient. You start feeling that everything has a very strong solution, but this strong solution comes through small, little baby steps which come through every day over a span of time. Friends, I understand that my presentation was very boring to you. I understand that I could not insert any excitement into my slides, into my presentation, but the intention was to make you realize what a surgical career is all about, what are the challenges, and how Kaizen can actually make a difference. I have not inserted any pictorials all I can tell you today for all those who are aspiring to become doctors or surgeons, surgeons are not born. Through the principles of Kaizen, surgeons are crafted and refined, and that's how they become competent and deliver the best. And surgeon's career is very immensely satisfying, I can tell you from my own experience. Thank you very much.